Hi, welcome to our Educating and Empowering You program for the month of May. We have some of our administrative staff here and Dr. Mehlhaus to help us kind of just do an update to the community about our latest COVID information as it relates to the pandemic. And just going to dive in here this morning with Dr. Mehlhaus, maybe starting us with just kind of an overview, and then we'll get into some specific questions too. So, Dr. Mehlhaus, can you give us kind of an update, a State of the Union address?
Yes. Thank you, Sarah, for having this forum today. Basically, COVID has calmed down some in the county. Has it gone away totally? No, it has not. We're still getting 1 to 2 patients a day in the hospital with COVID. Had a while for about a few weeks or about a month ago. We didn't have any in the hospital, but now we're back up to averaging about 1 or 2 a day. I think the big thing statewide, we've got our booster rate. We're above average for Boone County compared to the rest of the state. Not in the top 10% like we'd like to be. Our senior citizens have done a great job. 95+% of them are fully boosted. Overall, we're in the low 60s when we consider age 0 to 100. So we're above average. We're about 64, and the state average about 60 the last time I saw some statistics. Unfortunately, those do not come out nearly as often now as they did. I think a lot of it is the vaccine has started to take some effect in trying to prevent people from getting the illness, and if they do, they're not nearly as sick as unvaccinated. Big key right now is probably the fact that those 2 vaccines you got last year probably haven't gotten your second one about a year ago or year ago this summer. We know those are starting to wear off some, and most people are recommending that you get a booster shot, a third shot, sometime as soon as possible now, basically. I say 5 to 6 months after you get your second shot, get the third one. With that, there's one caveat, and that is if you got the Johnson & Johnson vaccine initially, do not get another Johnson & Johnson vaccine. There was a very good study out this past November, which showed that if you got one Johnson & Johnson, got a second one, your immunity got boosted by about a factor of 6. If you had the first Johnson & Johnson shot and then your second one was a Pfizer vaccine, your immunity got boosted by about a factor of 14. And if you got the Johnson & Johnson second shot was a Moderna, you got about a 16% or 16 time increase in your immunity. So Johnson & Johnson is kind of falling off the radar more, especially when you consider the Moderna and the Pfizer have full FDA approval now. Minimal side effects. Been well proven effective. Probably over 1 billion dosages have been given out worldwide. So I think we're pretty safe with that. Be encouraging everyone to get their third booster at this time. Now that booster recommendation has actually been out since last November, December, and such that now we're even starting to talk about a second booster. Approximately 5 months after the first booster. I think that's probably going to be the way to go here for most patients to make sure you do not catch COVID, and more importantly, if you do catch COVID, you're not going to end up in the hospital on a ventilator. You're going to end up with a mild cold for a couple of days and then back to normal activities. If you don't have the booster, there's a lot of people, even though they have that mild cold, I'm seeing them in the office 6 weeks later, they're still not back to normal. They're having what we call long hauler syndrome, which is a cough, chest tightness, feel tired, a little bit of a brain fog, maybe not even have smell or taste for very many months. Those are patients that not necessarily end up in the hospital. So again, that booster helps prevent that long hauler syndrome as well.
Yeah, great. I think that it seems like a lot of people are talking about just kind of anticipating having that booster every year. Is that what you're seeing will be true?
I would not be surprised if there is a yearly booster from what I'm reading. What that booster is going to be is still being debated. In some of the scientific literature, there's talk that Moderna and Pfizer are working on a second generation vaccine, which might get down more toward the base of this virus, so it'll be more effective against the numerous variants that we're seeing, like the Delta, the Omicron, etc. Now, this vaccine is still in the experimental stages. I have not seen anything to suggest, hey, the timeline for it to go to the FDA and then come out publicly. So I expect that's probably still many months away. Some people are even theorizing that instead of a flu shot in the future, you'll get a flu shot and COVID vaccine mixed into one syringe once a year. I don't think that'll happen this year because there's just not enough time. A year from now, that could very well be a possibility, but it's just too soon this year. So everyone will begin their regular flu shots and then a second COVID booster sometime, depending upon when they've had their first one.
And I guess along those same lines, is it similar in influenza in that there will be different strains and we can anticipate there will continue to be different strains? And maybe that's a question, Darla, you're nodding. Maybe you can help us answer or, or anybody.
Yeah, I just think with what we're seeing, like with any virus like that, with the flu and with COVID, we're going to continue to see different strains. It's going to be hard, like Dr. Mehlhaus says. Hopefully we can do something differently. It's a different vaccine, so hopefully we can be able to capture more of the variances. But it's new, so we'll see what happens in the future.
Okay, great. Well, thank you for that. Well, I think that some of the questions we might have too, or if there's anything else that you feel you want to add to that, but just maybe a pitch on why people would get that first or second booster. You kind of spoke to that a little bit too, Dr. Mehlhaus, and maybe how or where we're getting them now, because it feels like that information was everywhere before, and now it feels like we're not hearing as much about it as often. So whoever wants to take that question, of course.
Well, I think what I said earlier, as far as why do you get it, you get it to prevent yourself from ending up in the ICU and dying from this virus. Ideally, it prevents you from getting it, and it does a very good job of that. But if you do get it, it prevents you from getting seriously ill. And you get also, if you have the virus, you have the vaccine, you're not going to be sick as often. You're not going to be spreading it to your friends and neighbors to prevent them from getting it, especially those friends and neighbors who, for some reason, cannot get the vaccine. When to get the booster, said the first booster should be about 5 to 6 months after your second vaccine, and then the second booster should be about 5 months after that, the first booster. Right now, public health is having an occasional clinic about it, but the boosters are very much available at our local pharmacies, such that I'm encouraging most of my patients to call one of the local pharmacies to pick them up. As far as Pfizer versus Moderna, it really doesn't matter which one you get for the booster. In fact, the study I was talking about earlier with the Johnson & Johnson and being boosted by something else, that study, the other part of the study, they took patients who had gotten their first 2 Moderna vaccines and then gave me the third Moderna or a Pfizer vaccine. And what they found was if you had 2 Modernas, you actually got a little bit better immune response with that Pfizer being the third one. And on the same token, you had 2 Pfizers, got a little bit better immune response for that third one if the third one was a Moderna. And so, therefore, I don't worry about my patients trying to chase down because they had 2 Moderna, they're going to find someone that's got a 3rd Moderna. I don't get that excited about it. I tell them, whichever one the pharmacy has between those 2, get it. Your immunity is going to be the same, if not a little bit better, if you happen to get the opposite one. So check with your pharmacies. Medical Associates Pharmacies been a leader in this since we all started. Their owners have been trying to get the vaccine out to county as much as any pharmacy in the county. I believe Hy-Vee and Walmart also have the vaccines, and Medicap. The days that they have a vial open might change, so I'm telling people to call in advance and check to see which day that they're going to have the vial open, because the vials still come in tins, so they like to be able to have 7 to 10 people show up in 4 hours time when they have that vial open, so they're not wasting serum.
That sounds good. Appreciate that information. Maybe switching gears just a little bit to talk about the hospital, and again, up for grabs, who wants to maybe help us just have a message out to the community a little bit about why we're still screening people, why we're still masking here. I know there's some places that are starting to lighten up, so to speak, on those rules. And I think that there's a lot of people that are still asking questions about that in the community. So can someone address that for me, please?
Sure. I can go ahead and start. From the very beginning of COVID, CMS has followed the CDC recommendations for hospitals for screening of individuals that enter the facility, and also wearing of masks. They continue to follow those CDC guidelines to today, and what those CDC is saying, that hospitals have to have a process in place to screen any individual that's entering the facility, whether that's an employee, a patient, a visitor, and that we need to be wearing masks in the facility, particularly in those patient care areas. Over the course of the past 6 months, some of those recommendations from CDC have changed in regards particularly to masks, and maybe changing those locations, if you're fully vaccinated, to where you may go without a mask. So we were starting to have some discussions about looking at our current mandatory mask mandates and lifting those. However, just within the past day or 2, we've noticed that the larger hospitals, particularly in Des Moines, have now gone back to mandatory mask mandates for anybody because of the uptick in cases again. So CDC also has recommendations that you can look at what your positivity rates are in your area to help guide that. But obviously with an uptick now in cases, we just need to keep those safety measures in place. As far as screening people who enter the building, I think part of the reason why you see some differences between facilities is that there's nothing set in stone that says you have to do it this way. So facilities are just setting up different screening processes. For our hospital, we decided to have somebody physically present at those point of entrances was the best way to, number one, make sure that anybody entering the building is wearing a mask, and number two, that they're being screened for signs and symptoms of COVID or any recent exposure to somebody with COVID. And at this time, we just feel that that's the best way to do that process to keep everybody safe, whether they're an employee, a patient, or a visitor. So until CDC has some different recommendations or they loosen up on those screening processes, we'll continue to do what we're doing.
So in other words, there isn't really a timeline that we have in mind for slowing or stopping. It's just kind of a day-to-day.
Right. Yeah. To give you a timeline, we can't right now. Obviously the CDC and the Department of Public Health are constantly monitoring the COVID activity across the nation, but also, we can monitor it in our area as well. So until they make some changes to those recommendations, we'll continue to do what we need to do to screen individuals.
And just really quick, going back, I'm going to put you a little bit on the spot, but just for people out there that don't know what CMS is, can you tell us? I mean, I think everybody knows what CDS or the CDC is, but CMS might be a little bit less known.
CMS is Medicare. So any facility that is receiving Medicare funds needs to comply with their regulations. So their regulations regarding screening of individuals and wearing of masks, they refer to the CDC. So essentially, any hospital that receives Medicare funding, they're saying that you need to follow the CDC guidelines.
So in other words, that would also mean that if for some reason we weren't, we could have that funding in jeopardy. Is that a true statement?
We could if surveyors presented to our facility and saw that we were not in compliance with those regulations, then yes, there would be a monetary penalty, or could be.
Okay. Yeah. Interesting. Okay, thank you for that. Joe, I'm going to jump over to you. Is there anything you wanted to add from the hospital side of the world that is going on, or any updates?
No, just maybe some general thoughts, in regard to what we're saying. I think we're going to fall on the more conservative side. So when you ask, when are we going to stop screening, or when are we going to loosen up our mask requirements, I think my answer would be basically when we're the only one that's not doing it anymore. I just think in terms of being cautious, I think it doesn't hurt anything. It's an inconvenience, but I don't think anybody's really put at risk by wearing a mask. I mean, there are some people that have some issues that we try to deal with, but in any way, I think we're just going to be conservative, and without being total pessimist here, I don't think we're finished. I think right now we're in the middle of May, and there's some things happening in the northeast part of the country right now where we're seeing real dramatic increases in COVID again. And I think we know from experience that once it starts in one part of the country, it does not take very long for it to spread to other parts of the country. So we're going to be cautious. We're going to stay as aware as we can. This is very much repetitive here, but I don't. I'm not a scientist, and I'm not an epidemiologist, but I think we're not finished with COVID yet. And if you have the opportunity to protect yourself with a booster shot, I think that is an excellent idea, because I think once we get into the latter part of the summer and into the fall, we could easily see a real spike. And as Dr. Mehlhaus says, that shot might be the difference between having a cold or a trip to the ICU. So consider that. It's a reasonable thing to do. And I know the information out there. There's just so much information that's just basically not accurate, or it's trying to steer people in a direction that maybe the author of the article wants them to go. But vaccines don't prevent somebody from getting COVID, but they certainly have been proven to keep them safer after they do. So I just encourage people to do that.
Thank you for that. Is there anything that you would want to speak to of just staffing things happening in the hospital, or anything along those?
Well, that's an entirely different subject that may be slightly related to COVID, but the same staffing issues that are affecting people in all industries across the country are affecting hospitals and doctors' offices. So, when you go to a restaurant and they have half the servers that they used to have, or they're closed a couple days a week because they can't find staff, hospitals and physician offices are going through exactly the same thing. I will say, we're doing okay. We've been able to fill some key positions. We have not been in a situation where we've had to limit our services in any way, but it's it's a challenge, and it's not one I don't think that's going to go away in the next couple of months. I think it's something that we're going to deal with for some time. But again, this is a good place to work. I think we've hired some staff in the last couple of weeks in key areas, and I think that's real encouraging. And but yeah, I mean, it's a difficult time right now.
Yeah, and like you said, it seems like it's just everywhere, but good to note that we're still keeping on track and hiring good people to fill in those positions and moving forward. So,
and I think that, I think the key is to once staffing shortages start to impact the services that you provide, then you're in a real critical situation. We're not there at this point. We don't have that many staff. So, we have, RNs, for example. I don't know how many RNs we have, Laura. Do we have 50 or 60 RNs here at the hospital, or maybe?
We have over 100.
Oh, well, there you go. shows you what I know.
That's probably including clinics, right?
No, that could be, even a little bit more if you want to throw the clinics in. So, yeah.
Oh, okay. But so I guess my point is, and in a large department, our emergency department, if you lose one or two people, it's a big deal. So we're working as hard as we can to make this a good place to work, and we've done some things with compensation and trying to encourage people to stay, some retention kinds of things that we're doing. So we're doing the best we can with staffing, but it's an issue.
Yeah. Well, and like you said, it kind of started all of this across the country with the pandemic. So it's just kind of the residual effect of it as it kind of hopefully starts to slow down and get better.
The other thing that we don't realize is, there are lots of issues going on economically in this country, but unemployment is at a very low rate. There are more people looking for workers than there are workers, and that's across the board. And folks that work in hospitals have opportunities to do all kinds of things. RNs have many more options than they used to. Staff across the board there's lots of things you can do these days. And if COVID made hospitals a scary place to work, there were options for folks to do something else. But again, now that things have settled down, we're hoping we can get back into a more normal phase. Again, it's going to be a while. And we're also, this hospital association and legislature are working on things to improve accessibility to nursing programs and other training programs like lab techs and rad techs, all the folks that we need. So long term, hopefully we'll work through this. Right now, we just have to be real careful.
Sure. Sounds good. Thank you for that information. So just to wrap up, is there anything that we need to kind of conclude with, or anything else that we feel the community needs to know as we move forward?
I'd just like to make one final plug for the vaccines. The vaccines are coming out, and our kids, they're going back to school this fall. The vaccines for 5 through 12 are out, and out for quite a while. They've been proven beneficial, proven safe. They're decreasing the risk of transmission of the COVID. And if your kid does get COVID, they're not going to be nearly as sick as if they did not have it. And you got to remember, when you get the vaccine, you're not getting the vaccine just for yourself, but you're getting the vaccine for your neighbor too, to prevent you from transmitting it to your neighbor who mainly is immunocompromised and unable to get the vaccine themselves. So they're safe. The FDA is proving more and more safe. ACOG, which is American College of Obstetrics and Gynecology, they are strongly encouraging all women who are pregnant or who may be getting pregnant to get the vaccine ASAP, because what they have found is that pregnant women, if they get COVID and they have not had the vaccine, they have a very high risk of complications, including stillbirth, death of the baby, death of the mom, whereas they just don't see that in their patients who have been vaccinated. And again, that vaccination covers the baby too, once the baby's out for the first 4 to 6 months. So my big word of thumb is right now, we can still do more for this, but just getting the vaccines. They're safe. Most of the pills and IV medications we have, once you get it, there's still emergency use authorization, as the FDA has not fully cleared those. The vaccines, on the other hand, have been fully cleared. So please, get your vaccine. It's time to stop this argument and just go ahead and get the vaccine and move on with life.
Well, and I think a good point along those lines too is we've all experienced the opportunity to have the enjoyment of being together in groups again. And I think that we all can honestly say we don't want to go backwards from that and have the isolation that we had prior to this. So yes, keep moving forward and keep those our family gatherings and group gatherings through the summer and fall and winter something that we can all do if we're vaccinated. So thank you for that. Anything else from the group, or Darla? Any final thoughts?
My one final thought is if anybody is even considering getting the booster, I know there's a lot of traveling and stuff in the summertime. Just be aware that if you do get the booster, say you're going to go to the East Coast or whatever, we're not protected in the planes anymore, not masking. Plus, give yourself at least a couple of weeks after that vaccine or get the vaccine at least 2 weeks prior to your travel, so you have time to build up those immunities. You can't just get the booster and then go and be protected.
Okay, great. Thanks for noting that as well. Well, thank you all for being here today. We really appreciate being able to send this message out to the community, giving them updates, and maybe we can do this again here in the fall and just keep everybody apprised of what the latest is. Thank you.
Thank you, Sarah.
Thanks, Sarah.
Thank you,
Sarah.